How are transfusion infection risks minimized in SCD? Imagine needing a blood transfusion to help with sickle cell disease, but wondering how safety is ensured. Transfusions are life-saving, but they do carry some risks of infection. Thankfully, there are many careful steps in place to keep patients safe. First, all blood donors go through strict screening and testing. Blood is tested for viruses like HIV, hepatitis B and C, and bacteria that can cause infections. This testing is done before the blood is used, making sure it is as safe as possible. Next, many blood banks use a process called leukocyte reduction. This means removing white blood cells from the donor blood before transfusion. White blood cells can carry infections and cause immune reactions, so removing them helps prevent these problems and reduces the chance of transmitting infections. Because people with sickle cell disease often need multiple transfusions, they are at risk of developing immune responses to transfused blood. To prevent this, blood is matched not just for the basic blood types, but also for other antigens like Kell, Duffy, and KID. This extended matching helps avoid immune reactions that could make infections more likely or cause other complications. Sometimes, washed red blood cells are used for patients who have allergic reactions. Washing removes most of the plasma proteins, which can trigger allergies or immune responses. This extra step makes transfusions safer for sensitive patients. Monitoring the patient's hematocrit, or the percentage of red blood cells in the blood, is also important. If the hematocrit gets too high, blood can become too viscous, leading to complications. Keeping it within a safe range helps prevent issues that could indirectly increase infection risk. In addition to transfusion safety, preventive care plays a big role. Vaccinations against illnesses like influenza and pneumococcus help reduce overall infection risk. For young children with sickle cell disease, antibiotics like penicillin are often given to prevent bacterial infections. These measures help keep the immune system strong and reduce the chance of infections that could complicate transfusions. For patients undergoing treatments like stem cell transplants or gene therapy, immunosuppressive medications are sometimes used. During these times, close monitoring and preventive strategies are essential to prevent infections. In summary, reducing infection risks during blood transfusions for sickle cell disease involves rigorous donor screening, leukocyte reduction, extended blood matching, and careful patient monitoring. Combining these practices with vaccination and preventive antibiotics helps make transfusions as safe as possible. Always remember, it's important to work with healthcare professionals to ensure personalized and safe treatment.